First of all, a warm welcome and warm thank you to the organisers for this invitation to speak today. It's going to be a joint presentation by Sarcoma UK and the Bone Cancer Research Trust. So as two charities, both based in the UK, but both having a real patient focus, we're working independently on this area, but also recognising that there's lots of areas where we can join forces and achieve a lot more together. So today we'll be able to share some of the work that we've been doing individually, and then some of the early stages of a really exciting new collaboration where we're working in partnership. So I'm Sorrel and I'm based at Sarcoma UK, and I'll also welcome my colleague Tobi from the Bone Cancer Research Trust. Okay, so first of all, I mean, why should we place a focus on diagnosis? But really, the way I want to introduce this is that as a charity with a focus on people affected by sarcoma, we hear stories from people all the time about just how long and distressing the wait for a diagnosis can be. And I wanted to kind of share some of the quotes that we've come across in recent months. So first of all, I initially went to a GP with a small lump on my left foot, which was completely dismissed, even when it continued to increase in size. And secondly, if only one clinician that saw my dad along his journey to diagnosis had thought about the possibility of sarcoma, they might have saved his life. And finally, it took me 6 years to be diagnosed. When I was 15 or 16, I was going to the doctors every week, and still no one knew what was wrong or that it could have been a sarcoma. So I think this is a really powerful basis to show us just how damaging this long and distressing journey to a diagnosis can be for someone's well-being. And we hear this anecdotally very, very often, but we also know that the actual data that's available around diagnosis is very, very poor. But more broadly, we know that catching tumours early is important. So finding a tumour at a smaller size means there's less chance that it's spread, and it means improved outcomes. So early diagnosis brings long-term benefits. So at Sarcoma UK, we started to really tackle this area back at the beginning of last year, and we ran our biggest survey to date with over 1,000 responses from patients and their loved ones. So trying to capture the personal experience of what it's like to go through that journey to diagnosis. And I wanted to share some of the top line results with you today. So in terms of awareness, first of all, in the top left here, 79% of adult patients hadn't heard of sarcoma before they were diagnosed. So awareness is low. But once people start to experience symptoms, 14% of people told us that they took more than 6 months before they went to see a healthcare professional about those symptoms. And then once they do get to be in front of a doctor, 35% of patients told us that they had to go and see a healthcare professional more than 3 times before they were referred for further tests. So they're having to go back multiple times. And then on the right-hand side here, I think this is the strongest finding for us really, that 30% of people took more than 6 months to receive an accurate diagnosis. And really shockingly, 17% of people were waiting more than a year. So that's after initially going to see a healthcare professional for the first time. We're seeing many people taking 6 months or a year to finally reach a diagnosis. And disappointingly, at that first appointment where someone first speaks to a healthcare professional about their symptoms, 39% of people were either started on treatment for another condition, or they were told not to worry, your symptoms aren't serious. So this is just the UK picture from this survey, but we're starting to pull out a clearer image of where these delays exist and where the issues around diagnosis are occurring. So we wanted to, make a richer picture than just the results of a survey. So we combined this data with conducting a literature review, examining the peer-reviewed research that's been done in this area, and also looking at data from other cancer advocacy bodies and government research as well. And we also had lots of conversations with patients and their loved ones and with clinicians to really understand what goes wrong in that journey to reaching a sarcoma diagnosis. And we pulled this all together and put together a comprehensive large policy report, which you can see on the right-hand side there, which we've called Delays Cost Lives, and it's a call to policymakers to improve the early diagnosis of sarcoma. It's a very, very long report, but you can access the full document on our website. But today we're not here for policy discussion. I'll just share that the key recommendations that we've called for in that report are for increased and improved healthcare professional education about sarcoma, for improved and more effort around public awareness of the key symptoms of sarcoma, and finally for improvements to that referral pathway and how scans are undertaken to make that more efficient and we're not losing many people along the way. So in terms of what Sarcoma UK took as our next steps, we, off the back of this policy report, we knew that early diagnosis was a huge priority for people with sarcoma. And so we have built that topic into our strategy as one of our core points. So we launched our new organisational strategy this year, and you can see the 3 key areas in the bottom right here. And one of those is that patients will be diagnosed earlier. So early diagnosis is really at the core of what we do now. And to help guide that work, we have put together an expert steering group made up of advocates, so that includes patients, clinicians who will help to monitor and guide our work in this area as we go forwards. And we've already got off to a bit of a start. So we're working with an organisation called Gateway C to build some education modules which are directed at primary healthcare professionals. So this is your kind of family doctor, to try and start moving the dial on healthcare professional education and get something off the ground. But more broadly, we recognise that this is a really complicated area and we're not going to tackle it alone. So we want to work more in collaboration, which is where I'll bring in my colleague Tobi, and I'll hand over to you to tell us a bit more about the experience from the Bone Cancer Research Trust side.
Thanks, Sorrel. And thank you everyone for this opportunity to talk today. I'm going to be presenting some data from our 2020 patient survey. The objective of this survey was to be able to provide healthcare professionals with the tools that they needed to recognise the symptoms of primary bone cancer and to emphasise the referral pathways. The 2020 patient survey that we conducted was the most comprehensive analysis of the symptoms and diagnostic experiences of primary bone cancer patients to date. We had 739 responses from across the world and 312 from the UK, and this can be accessed on our website from the link below. Next slide, please. We asked patients about the anatomical location of their tumours, and this is broken down on the skeleton diagram on the left. As you can see, nearly half, 44% of primary bone cancers occurred in the lower limbs. But interestingly, when we asked patients about their pain, 32% of patients suffered from referred pain. So that's pain that's actually not at the site of the anatomical location of the tumour. And the conclusion that we drew from this is that it's really important to image the correct area, because imaging the site of where we think the tumour is not always entirely appropriate. And when we asked patients about their more general symptoms, 32% reported fatigue. And so collectively, these results suggest that we can't just look at symptoms in isolation and that a broader picture needs to be taken into account when diagnosing sarcoma patients. Next slide, please. So where did patients present and how long did it take to receive diagnosis? In the UK, 76% of patients first reported their symptoms to a GP and 11% to A&E, but a lot presented to other departments as well, such as physiotherapists and X-ray and imaging departments. The graph shows that in many departments, patients had to visit between 1 and 3 times, but also this extended between 4 and 12, which can be seen in the orange and green. And the average number of times that someone had to present to a GP in the UK was 4 times. And overall, the average number of visits to a healthcare professional in the UK was 8.2 visits versus 6.5 outside the UK. Next slide, please. So when we asked patients about their diagnosis, many patients reported non-diagnosis, misdiagnosis, and alternative explanations for their symptoms. Overall, combined, 76% of patients received a misdiagnosis as part of their diagnostic journey. 79% of children, 78% of teenagers and young adults, and 73% of adults. The most prominent misdiagnosis for children was growing pains, but also sporting injuries and pulled muscles were a common diagnosis for all ages, with more older patients receiving diagnosis of arthritis and sciatica. In patients who presented with tumours in the jaw and skull, patients were diagnosed initially with migraines, tooth abscesses, ear and sinus infections. And when we delved deeper into this data, we found that in the UK, 43% of children were diagnosed with growing pains initially, compared to 23% of the children outside the UK. Next slide, please. So when we asked patients about the time to diagnosis, we looked at the patient interval, diagnostic interval, and collectively the total interval. So looking at the patient interval, which is in orange, we can see that patients in the UK generally presented a lot sooner than patients outside the UK. But however, when patients did present, it took a lot longer, 6.1 months compared to 4.3 months outside the UK to get diagnosed, making the total interval nearly 8 months inside the UK and 6.6 months outside the UK. So putting these statistics together, we found that on average, patients in the UK had to visit a healthcare professional 8.2 times before being referred, compared to which is 26% more than outside the UK. So we set a target of wanting healthcare professionals to reach a diagnosis within 1 month, because currently it's 6 months. And if you put this in the context of the NHS's urgent cancer referrals waiting time, which is 2 weeks, we think this is a very achievable and realistic goal. Next slide, please. So that was great. We had some fantastic insights from our survey, but the question stood like, what do we do next? What's the next step in this journey? So we knew that healthcare professionals were the healthcare professionals that were most visited were GPs, physiotherapists, A&E, X-ray and imaging departments. So we assembled our own team of heroes, our expert task force of medical professionals who provided their professional support and expertise in helping us design information and webinars for the professionals and the public. Collectively, this was the Bone Cancer Awareness Initiative, and we provided healthcare professionals with the tools they needed to recognise the symptoms of primary bone cancer and clarify the referral pathways for each specific cancer. So we created flashcards, educational posters, and delivered a series of webinars. And to date, we've reached out to 12,811 pharmacies, just under 11,000 GP services, 586 physiotherapy practices, 44 medical schools, and 1,542 hospitals and radiology departments across the UK, which is a fantastic achievement. Next slide, please. So I wanted to conclude my section of this talk by just leaving you with a quote, which was from a physiotherapist who attended one of our webinars. And they said they thought it was excellent. And in their 20 years of training, in their 20 years of practice, they'd never received any training in the area of sarcoma. So that really just emphasizes and highlights the importance of the work that we're doing. To date, the webinars were attended by 2,038 healthcare professionals and medical students. But because all these information resources are available for free on YouTube and on our website, this number is still climbing every day. So I'll pass back to Sorrel, and thank you very much.
Thanks, Toby. So I suppose from what you've seen so far, you can see that as organisations we're on similar paths, and we've had some similar findings along the way. So I'd say almost up to a year ago, we started getting together just to try and talk and discuss our work around early diagnosis, so that we could begin to share ideas and identify some areas where we thought we could work together. And quite early it emerged that healthcare professional education was a really an obvious area where we could collaborate. And as a first step, we've chosen medical students as a priority for this work. So what was really nice is that the Bone Cancer Research Trust were a little bit ahead of the game here. So they've been hosting medical students from the University of Sheffield in the UK to conduct some small research projects since back in 2018. And they've worked on things like the impact of surgery and emotional well-being. But last year, some of those students chose to focus on diagnosis. And so very kindly, the Bone Cancer Research Trust invited us to collaborate on that work. So those students started to tackle questions like, how medical students do prefer to learn, because we know this is changing over time. Students aren't burying their noses in textbooks anymore. So we got those medical students to focus on some of those wider issues of what tools are out there at the moment, what modules exist around sarcoma, and how could they be adapted, and how could they be improved. And those students also took some first steps to designing a survey that could go out nationally to other medical students to ask about what they're learning about sarcoma. And so on the basis of this, we then took these findings away from these initial medical student projects, and we decided to jointly launch a nationwide survey of medical students to explore what they're learning about sarcoma. Do they cover it in their medical schools? How confident are they to identify a sarcoma from the symptoms? And what kind of resources do they use? How are they learning? And how could we best target a sarcoma module to those students? So we launched that survey just a couple of months ago, and it closed just a couple of weeks ago. So these are just some screenshots of how we tried to share the news of that survey launching just in the last couple of months. So this is really us taking the first concrete steps towards collaborating together in this space. We're now working on the analysis of that student survey, but we would really like to repeat this collaboration and do more work on those projects directly with medical students while they're in place at the Bone Cancer Research Trust. We know this is a great time because the Bone Cancer Research Trust are just developing a new 5-year plan. So we hope to see early diagnosis being featured there, and it's an opportunity to scope that out. And we've taken some of the first steps to strengthen these links. So on our side at Sarcoma UK, we're building this expert steering group, and we've invited one of the Bone Cancer Research Trust members of their board of trustees to join us, so we can strengthen that partnership and build more links together. But we definitely have plans to broaden this collaboration, and that doesn't just go for us. So if anyone's out there who would like to talk more about early diagnosis, we would love to hear from you. So I'll close there and just say thank you, and if you would like to get in touch, there's our contact details.